Hello and welcome to Digital Medboard. Here we go. The gluteus medius and gluteus minimus are abductors and medial rotators of the hip. They also stabilize the pelvis while walking. When we walk, there are two main phases, stance phase and swing phase. Stance phase means when the foot is fixed to the ground. Swing phase means when the foot is in the air. If the foot is fixed to the ground, the femur remains stable and cannot move. Instead, movement occurs at the hip bone. As a muscle contracts, the hip bone moves closer to the femur, which effectively pulling the pelvis downward. During swing phase, gravity tends to pull the pelvis downward. However, it does not happen due to stabilizing mechanism. Since pelvis functions as a single unit, if the right side of the pelvis moves downward, the left side moves upward. This mechanism prevents excessive pelvic drop while walking. Now let's examine the abnormal case. In this scenario, the pelvis drops on one side due to gluteal muscle insufficiency, which can be caused by a superior gluteal nerve lesion. This condition may result from poliovirus damaging L4, L5 and S1, or congenital hip dislocation, or femur neck fracture. A positive Trendelenburg test on right side indicates an issue with the right gluteus, medius and minimus. To perform this test, ask the patient to stand on their right leg. If the left pelvis drops, it means the right side is affected. If the patient cannot counteract gravity, it will drop with each step, causing the patient to drag their affected leg due to an apparent increase in leg length. Since dragging the leg is inefficient, the patient compensates by tilting the spine towards the affected side, resulting in a lurching gait. For example, if both sides are affected, the patient develops a waddling effect. We got a question. A patient was asked to stand on his right foot and his left hip falls down. Which among the following muscles are affected? Since the left hip falls down, the issue is on the right side, indicating weakness or paralysis of the right gluteus medius and minimus due to a superior gluteal nerve lesion. Therefore, option D is the correct answer. If you found this video helpful, don't forget to like, share and subscribe to Digital Medboard. Got questions? Drop them in the comments below. See you in the next video. Until then, stay tuned. Choose.